Very excited for the 2023 World Conference on Lung Cancer that's going to be happening in Singapore. I'm going to be presenting our group's research that's assessing the availability and demand for patient-friendly resources in lung cancer care, hoping to really focus in on the patient perspective. I will start with our key conclusions first. And what we found was that most patients with lung cancer use online resources to learn more about their disease and treatments at time of diagnosis. However, most reported a lack of patient-friendly resources that are currently available. And so most patients actually prefer their oncology provider to be the one to explain the data that supports the recommended treatment plan, and they want it in a patient-friendly manner. And finally, patient-friendly summaries of cancer clinical trials could effectively bridge this communication gap that really exists right now. As you know, over the years, the growing use of open access publications, online platforms, it's really shown us that there is this need to make sure that the cancer research and information that we currently have available is accessible to everyone, especially our patients. And so to better understand the current patient perspective, what we did was we surveyed patients with non-small cell lung cancer, ultimately received 58 patient responses. The majority of the responses came from patients who were female. They were from North America and had a diagnosis of stage 4 non-small cell lung cancer. And just over half of them were actually getting their care at an academic or university hospital. At the time of their initial diagnosis, we found that 95% of patients and over 2/3 of their caregivers or family members actually went online to learn more about their disease, learn more about their treatments. And over 80% of these patients, when they found information, they found that the information they encountered was either neutral, difficult, or just very difficult to interpret. So 93% of these patients would have actually preferred to receive easy to understand information about their cancer diagnosis and their treatments directly from their oncology provider.